These are called attractor landscapes or heat maps or whatever. Well, heat maps is a variation of them. We're doing work, for example, in Colombia at the moment, in 5 Colombian cities. We're about to deploy children and university students as field ethnographers. So children will keep daily diaries of what it's like to have a father or a mother trying to set up a corner shop. And critically, we don't rely on text interpretation because we take photographs and voice as well. But the data is self-interpreted into geometrical shapes, which gives us quant data by the people who tell the story, which means I can scale to large volumes very quickly. Because what we want to do over 5 Colombian cities is get early, immediate, real-time feedback if a pattern of government behavior is preventing an entrepreneur from stabilizing a poor area, because if we don't do something quickly, the drug barons will get re-entry to those streets. We've done similar work in Mexico, Pakistan, and elsewhere. What you're doing is creating an immediate, fast, real-time feedback network. You're not waiting for people to tweet or blog or post things. You're creating a network which can act as citizen journalists, is a key phrase here, to gather and promote data so that you've got a trusted network when you need it. Nobody trusts Twitter in the development sector anymore after a natural disaster, because some people think it's really cute to pretend they're trapped under a bed and divert rescue teams, because you actually have an anarchist approach rather than a managed approach. It's chaotic, it's not complex. Creating human sensor networks is quite key. Those maps there, the white grid has, I think in that particular case, 20 or 30,000 self-indexed micronarratives. The hollows represent stabilities, the peaks represent instabilities. The saddle points between the peaks represent areas where change could happen quickly. Remember I talked about mapping dispositions? What that says is things will fall into these hollows, but these things might change quickly. So what do I do about it? The other thing those models do is the yellow dots represent outlier events. The problem with nearly all search algorithms on the net and nearly all research methods is they work off Gaussian distributions. They eliminate outliers. Outliers are where opportunity and threat sits. And the ability to see the big picture and the outliers simultaneously is absolutely key. And the ability to have the primary human interpretation is there. A couple more examples and I'm going to finish off. We're starting work with one of the big US medical colleges at the moment in what will be a multi-billion-dollar business, I think, to actually get patients to use an app to keep a continuous diary of their experience of hospitals. Also primary care, secondary care, community care. But on a minute-by-minute basis, and actually that human signification, the quant where it's traditionally qual, we don't want to use computers to interpret the text, we want the human being to interpret the text. Now that allows us to measure the impact of all stages of the health sector on an individual. It also allows us to get early detection of patterns which would indicate somebody has been discharged too early, which has massive financial costs in the States at the moment. And on the first trial project on this, to give you an idea, aside from measuring impact, we also created a knowledge management database for doctors and nurses, because micro-narratives are more valuable to people than best practice documents. Yeah, we evolved to synthesize and blend stories. We didn't evolve to read documents. Yeah, so modern knowledge management takes that approach. The two things we didn't expect, and this was a cancer hospital, is nurses, through the indexing on the stories, were able to identify cluster patterns of depression, because chemotherapy is heavily dependent on people's attitudes. So if you've got some patients taking things down, you want to pull them out and move them into a private room. The other fascinating thing is 50% of the unprompted stories were about hospital hygiene, because for patients, the lack of compliance with care regimes was obvious, but it wasn't to doctors because they were familiar. So now we've actually saved a huge amount of money by using patients as a sensor network effectively for hygiene discipline, which has a major effect on viruses and everything else. Start to get the principle on this stuff? By using technology to augment human sensor networks, we get there. We're building networks at the moment for one country which will have 20,000 kids keeping a daily diary of what it means to be a member of that country. That replaces market research and polling more effectively, but it also gives us a network. If it gets hit with a natural disaster, we can activate immediately. I say that creating networks for ordinary purpose, you can activate for extraordinary need. but designing them based on a science-based approach to the understanding of cognition.